Welcome into Rounding the Bases.
Round the bases. Everybody knows Joel Goldberg. It's around the bases. Everybody knows Joel Goldberg.
Welcome back to another episode of Rounding the Bases, presented by Community America Credit Union, invested in you. I'm Joel Goldberg, and we've got not one but two great guests today. Quick shout out to my friends at Chief of Staff Kansas City. Love the connection with them. They're all about connections. If you are in Kansas City or anywhere around the country for that matter, if you're looking for a job, if you're looking to hire someone, if you're looking for a resource, great office, good culture, good, energetic, young vibe, and amazing people. Love partnering with them. So if you want to reach out to them, don't need to mention my name, you can, whatever. It doesn't make a difference either way. chiefofstaffkc.com, making connections that matter. Over the course of this podcast, last about 8 years, and my speaking business, I've made some incredible connections. One of the best that I made was through a woman named Danielle Welsh. Shout out to her, because I know Danielle is listening to this episode. I bring her up because she did my marketing and so much of my digital work for a number of years. Amazing to work with her and to grow with her. And she introduced me to my guest today. So often my guests are through connections. And when Danielle says, hey, I got somebody great for you, I don't doubt her one bit. And so I'm really excited to be able to make this connection. On today's installment of Rounding the Bases, I'm joined by a father-son duo bringing medical relief to communities far and wide. First up is Graham Morsch, president and CEO of Docs Who Care, the healthcare agency redefining rural care. His official tenure may have begun in 2015, but its mission has been shaping his life for decades. That leads me to today's second guest, and Graham knows this guy pretty well, Dr. Gary Morsch, the esteemed humanitarian, founder of Docs Who Care, and executive chairman of the Global Care Force. Together, they harness the power service in their mission to make a difference, unlocking more than excellence in care, but a positive impact that ripples around the world. And so I am joined right now by the two G's, Gary and Graham. Gentlemen, how are you?
Terrific. Doing great.
Yeah,
well, glad to be here.
I think, Graham, the first time that you and I had a chance to talk was at a Royals game, and you were out there with Danielle, and it was great. You guys were kind enough to hang and wait through the post game show. We walked out together and really didn't get a chance to delve into too much of what you're doing, but certainly it's been a family affair for a very long time. So I'll start with this. Let's begin with Graham, even though, Gary, you started all of this. Graham, you had the perspective of someone being, I guess, a little bit on the outside, but really on the inside as family, but now this being your life's work as well. Tell me about your early recollections of this and now what it must be like to be right smack dab in the middle of it.
Sure. Yeah. So Docs Who Care actually started when I was 8. So kind of grown up with the organization. Some of my coworkers shared the other day that they used to come over to our garage to get the mail for the business and would watch me coming home from school every day. So that was kind of and some are still working here. So that's kind of neat. But I used to actually go with my dad on shifts to some of the rural hospitals, and he would bring me along, and I'd sleep in the call room and get to see the patients with him. So that was kind of my early recollection. And I never thought I'd actually work for Docs Who Care. I thought I'd do my own thing, but 10 years ago, decided to jump in.
Well, and we'll get more.
Glad you did, Graham.
It certainly has worked out well. We'll get more into that too. I'm always fascinated by family business or family connections, because that either works really well or it doesn't work well. Obviously, it's working well. And I started out, I think, Graham, with you just because your perspective, 8 years old and on, you couldn't have been thinking at that young age, hey, one day this is going to be me. Or maybe even once you got into college and out of college, you weren't necessarily thinking that way. It's obviously turned out in the best of ways. But let's go back then to the beginning And Gary, you're going to have a different perspective because you started this thing. Tell me how this came to fruition.
Well, I was trained as a family doctor, family physician, and was able to start my practice in Olathe, and did the full family practice, thing with delivering babies, taking care of all ages, rounding at the hospitals and in Kansas City where I had inpatients. But I always wanted to give a part of my time to humanitarian work, to helping people who didn't have access to health care, whether that was in my own community here in Kansas City or whether it was somewhere around the world on a medical mission type program. So I was spending a lot of, up to 2 months a year in my private practice working in various places around the world as a volunteer. Graham, you probably remember going to Papua New Guinea. We were there for, I don't know, several weeks, and the whole family came. And so as I continued that, my colleagues, other doctors, nurses said, we'd like to do something like that. We'd like to be a part of something like that. So I decided to start some kind of an organization that could really plan and organize teams like this to go. So I brought on I hired a person in my medical practice actually to sit in my office and help me organize volunteer teams. And this led to the founding of Heart to Heart International 30 years ago. And it really took off fast. And I had to make a decision. Do I stay in private practice, or do I go, or do I quit medicine and go with Heart to Heart? I felt like I needed to stay with Heart to Heart, the organization that I had founded. So, but I had to make a living. So I got a job as an ER doc, emergency medicine doc. And that I started getting calls from rural hospitals across Kansas and saw that these hospitals were really struggling. They couldn't keep doctors. Doctors finishing their residencies, they just don't want to move back to the rural areas many times. Or maybe they do, but their wives don't, or their husbands don't. So I saw that need, and I decided, I want to do something about it. So I started with one hospital, took over the little hospital. They had gone from 3 docs down to 1. So they needed help in all areas. So that's how Docs Who Care began 30 years ago. And a second hospital called, and then a third, and it just seemed to keep going. And now Graham is the CEO, and he can tell you what one hospital led to 30 years later, almost 30 years later.
And here we are all these years later. And where is it, Graham, now versus when it started in terms of growth, but also in terms of need?
Sure. Yeah. So we, like my dad said, we started with one hospital and just kind of organically grew from that point on. Today we're in 7 different states, in Kansas and the surrounding states, as well as Washington State. And we work in about 115 different critical access hospitals every year. And those could be anywhere from 1 shift a year, working the Christmas holiday to give their local physician time off with his or her family, all the way to 24/7, 365. So the need has grown even more since back in 1995, as less physicians are moving to rural communities, and just we read about the shortage of especially family physicians. More want to go into specialties or concierge medicine, or not necessarily that path. So
I mean, it's interesting because you would think that the world progressed, that this would become better, but in many ways, I think, Graham, what you're saying is, at least in terms of the rural communities, it's become worse, right? I mean, if I'm hearing it correctly, there just are more options for docs out there that may make more sense for them, or may make more sense for their patients, or may make more sense for the well-being of their families and their business. So I guess what's happening is that people are getting left behind in those rural communities. And so
and not to disparage young physicians, because I think we've made a lot of progress for both young physicians and APPs, which are PAs and NPs. But the old time physicians were okay to work 24/7, 365 and, not really see their family or have a life outside of the hospital, where, physicians now, they do want to have that work-life balance and, be able to raise their kids, again, which is progress. But again, it's caused even more challenges in the rural communities.
That's an interesting point too. And Gary, I want your perspective on it, because that's not just the world of medicine. That's everywhere. I mean, you name me any young professional right now in any industry, and look, I think it's wrong to sit there and say they're not willing to work 24 hours a day as if there's some kind of laziness to that. I sometimes think that maybe my generation, and I think I'm probably in between you guys in generation, but I would lean more towards the way that Gary came up. And Graham, I think were probably raised that way as well. But my point is that, like, my kids right now, they're in a generation where you're not thinking about working 24/7. I couldn't think of any other way in my 20s. That's just the way I was going to do from a broadcast standpoint. If I had to work 16 hours in a day, fine, good, let's go and do it, and we'll come back and we'll do it again tomorrow. And that's just the way it is, and keep on grinding until you make it. And now we have a generation that says, you know what, that might not be the best for our health. That might not be the best for our families. And oh, by the way, we're allowed to take a little bit of time.
Yeah.
So how do you balance all of that? Because the world's always going to keep changing.
Well, of course, I finished medical school and my my residency. I finished medical school and my residency kind of in the that period that was transitioning from the old style doc that would do everything and sacrifice everything. Now, of course, we tend to throw millennials and Generation Z under the bus sometimes, like, what's the deal? How comes they can't work? How comes they can't take responsibility or whatever? But really, my generation and the one ahead of me that I learned under, really, they lived unbalanced lives. They sacrificed, many of them, their families and many things just because that was the expected. So today we have young docs, nurse practitioners, PAs coming out, and they want a work-life balance. And I respect that. And that's really the healthy thing. So what Docs Who Care has done is said, okay, you want that balance. You don't want to be on call 24/7 or even 5 days a week or 4 days a week, 24 hours at a time. You want to live in Kansas City or Wichita or Omaha or Denver or wherever and have your family. Your spouse may have a job and a life in a large urban center, but guess what? You can work in a rural community. You can travel there and make a huge difference. And it's not just a one-off, like, well, I'm going to show up and help them one time. It's a team of doctors that we put together. Maybe some of them are in Kansas City, maybe some are in somewhere else, but they take on this rural hospital and they say, this will be our practice. And so when I started my group, First Hospital, people would say, why don't you just move here? And I said, well, I have. I'm here 1 week a month, or I'm here so many days. And so I have moved here. We mean, why don't you permanently move here? And I said, I really can't. I don't feel that's right for me and my family, but I will give you everything you need while I'm here. And I'll be here month after month after month after month. And I did that for years. And so we have teams of providers who have worked together for decades since we started and still serve in the same communities. And so they're fulfilling a tremendous need in these rural communities. So it's a wonderful thing. And it makes a great living for our providers and for Graham, our staff, and for me. So it's a win-win.
Yeah, it's reflecting more of the modern world we live in. I think, Gary, that if those were options that were presented to us in previous generations in whatever our profession, we would have taken it. Those options were never presented, and to even suggest or ask to do something like that would have probably had you out on the street. And so we evolve. I say to audiences all the time when I'm speaking that my belief still is just suck it up and go work. But I wouldn't ask the younger generation to do that because they know better and they're better for it. This is just the way that I was raised and that the way I came up. But that doesn't mean there isn't a better way. And I'm curious, Graham, what the response is from those practitioners, or maybe it's just an expectation at this point, like anything else, where you can choose some of your hours, that you don't have to be beholden to the 24/7 schedule of a doctor and being on call every single moment. What type of feedback do you get from a standpoint of maybe some freedom for these people that probably already paid all of their dues in terms of 24 hours a day during medical school?
Sure. No, I feel like it's definitely, the feedback we receive is super positive, and it's really a win-win for both the providers that come and work for Docs Who Care and the hospitals. So, the providers that want to come work for Docs Who Care, the reason they want to, one of the main reasons is that work-life balance, because they can choose their shifts. They have the autonomy to work as much as they want or as little as they want. So we've had physicians that want to pay off their med school debt in 2 years. So they work like dogs, for 2 years and can easily pay off, $300,000 and still live, and then they can dial it back. We have other providers that like to travel and either do mission work or go on, extended vacations. And so, they can work 2 weeks and then they can take off 3 weeks, where if you're working as an employee at a hospital or a clinic, the chances of them allowing you to do that are pretty slim. So, the providers that come on board with us, I would say that's their number one reason, as well as the mission just of serving the rural communities. And, they may be burned out from a big corporate type structure as well. That type of hierarchy where they want to be the sole doc or APP and be in that role.
Isn't there an expectation though now, Graham, from the younger generation that they have this freedom and this ability to choose their path?
Definitely. Yeah. No, I think that's what we hear every day when we're talking to prospective providers. And,
right.
The hospitals that are reaching out to us realize that too. If they do have employed physicians or APPs, if they want to keep them, they reach out to Docs Who Care so we can supplement their local staff. So that way they never have to take call on a weekend. So, there's a hospital in Nebraska we've done every weekend for 20 years. The CEO realized, if I want to keep my docs long-term, the Monday through Friday, I need to give him every weekend off. And, his retention at that hospital has increased because of that. So,
because if I understand it correctly too, Gary, and I think it's been a bunch of years, but I did a podcast a number of years back on rural medicine, and as I was researching that, I mean the danger of some of these hospitals closing, and then what that does for a community. I don't know that we can fully, and when I say we, I mean just the average person in our case in the suburb of Kansas City, or name any other suburb around the country where you could go down the street. I mean, I could pull out of my house and drive 30 seconds, 45 seconds to a 24-hour clinic if I need to. I don't even remember whose hospital it is. It doesn't make a difference. If I need something immediately, I can go down the street. I can walk there if I need to. It's 1 minute away. It's wedged across the street from the Starbucks and the Chipotle and on and on. That's not an option in a lot of rural places. So when that hospital closes, if I understand all this correctly, that may have the impact of someone needing to drive an hour and a half, 2 hours one way, and then back. And maybe that's day after day, or maybe. So you're talking about, care, life being so much different than it is. And that might be 50 miles away from us, 60 miles, 100 miles away from us, and almost like a different world. So how much is this helping the system overall, that ability to place those doctors, staff those doctors, and to be able to keep these places going that are so oftentimes in danger of shutting down?
Well, you said it well. It's a different world. And we living in urban areas, we have so many choices, so many options. You don't worry that you're going to lose your doctor, or you're going to lose a hospital and have no hospital or urgent care. or emergency rooms. So many of the communities we work in, there's only one hospital in the community or in the whole county. And out in Western Kansas, these counties can be pretty large. So it's devastating. Many times in a small community, the hospital is either the largest employer or perhaps the second largest to maybe the public schools. If the community is fortunate to keep they don't have a consolidated rural school district. So there's just a lot of factors that impact these communities, and the hospital is one of the key things. And so anything we can do to keep those hospitals open. And I always say to CEOs of these hospitals when they call us is, look, Docs Who Care, our mission is not just to help you survive. Right now you're in survival mode. We want to help you survive, but we want you to thrive. We want you to get back to a stable level of providers, whether it's nurse practitioners and PAs, or whether it's doctors, and whether the doctors live in the community or not. We want the same ones coming to your community, so your patients have that continuity of care. So that's our mission, and we love our mission, and that's the thing that started us. And the mission, focusing on the mission, not on profits. Graham has heard me say many times, if all we do is break even, that's good enough. If we can generate a profit, that is icing on the cake. But we actually have scholarship programs for certain rural hospitals. They can't afford the standard rate. This is why they can't get a doctor. They can't afford it. So we actually have scholarship rates. We've actually supplied doctors to hospitals in an emergency situation for free and not even charge them as our service to help that hospital weather that crisis, whatever that crisis is. So it's a different world, and we're blessed to be part of it.
Following up on that real quick, Gary, I mean, having traveled all over the world and having been to third world countries, and by no means am I suggesting that the rural areas of our country are like third world countries, although I know that in certain cases it is. And I think that a lot of that can happen because of a lack of services, whether it be lack of medical access or even sometimes, internet, cable or Wi-Fi, that it's just not there for them too. I don't want to make the comparison to third world countries yet. I wonder if there is some similarity, which to me would be eye-opening for a lot of people that aren't living in those communities. I'm wondering what you see in terms of similarities, because that feels like that's something that shouldn't be happening in our country, yet it is.
Yeah. Well, whenever people, and of course I do work in third world countries and all over the world. I was just back from Ukraine, where my newest not-for-profit global care force that started during COVID. We send teams there every month, also to the Middle East and to the border of the United States and Mexico with the crisis there on the borders. So there are people throughout the world that have either no access to healthcare or limited. Now, I would say, and that's in the United States as well. In the United States, I'm not sure I could say someone has no access to medical care. Now, they may not be able to afford it. Maybe they have a low-paying job at McDonald's or somewhere, and they just can't afford. They don't have health insurance. They don't qualify for Medicaid, so they can't afford it. So yeah, there are people that really, really have almost no access to health care, except the emergency room, which are required by law to take care of anybody without regard to their ability to pay. Now, they may get turned over to a bill collector and be harassed and have to file for bankruptcy. The number one cause of bankruptcy in the United States is medical debt now. And so it's a sad state. But what for sure in our country, there are many, many areas, particularly rural areas, where there is limited access. They have difficulty accessing healthcare, and it may be because their hospital closed or the doctor left, and they're struggling to try to find someone to come back to town and be a part of that hospital or that clinic in that small community. So Docs Who Care's focus is on the United States. And we've talked about international, trying to do something internationally. For now, what I try to do is mobilize healthcare professionals to volunteer for 1 week, 2 weeks, a month, and we place them throughout the world in places where there's, for instance, in Ukraine where we're working, there's no access to medical care in those Ukrainian communities that have been, they were taken over by the Russians, and they destroyed the clinics and the hospitals, and the doctors have left. They're refugees. They've come to Europe or the United States, or they've been called up by the military in Ukraine to go to the front lines. So there's a huge need in Ukraine, for instance, right now. Whereas before the war, they had an excellent healthcare system. People had access. So our goal, really, Graham and I's mission at the end of the day, is to increase access to healthcare wherever it is in the world, in the United States, on the border, or worldwide. So, but there is a great need. People don't realize it in urban areas. The difficulty in people, especially in rural communities, having access to quality healthcare as well.
Graham, I'm curious, before we get to the baseball theme questions, what you hear, what that response from a community is, or maybe you hear that from one of your docs, practitioners. I have to think that the feedback is uplifting when suddenly a community feels like, wait a minute, we are getting the attention that we deserve. What do you hear?
Yes, it's super uplifting and fulfilling. And, we're really big on face-to-face relationships with our hospitals. So, our staff, as well as myself, we're doing road trips to, all over these rural communities so that we can meet with our hospitals, as well as whenever we see them at the hospital association conferences. But, whenever we see them, it's all hugs, and it's all, we wouldn't have made it without Docs Who Care. Thank you so much for, what you did to help us keep our hospital open. It doesn't feel at all like, we're a company that's selling services. It's a partnership, and the feelings are mutual. And, most of the time the hospitals that we work, they want to hire our providers because they're such high quality and mission focused. And so that's also just a great reflection on the type of providers that we send. We want the hospital to want them to come back and to be a permanent part of their community. And if the provider is willing to move to that community, we will release them without fee or anything. We're okay to take ourselves out of that job and just allow the hospital to hire the physician, and because that's ultimately what's best for that community, not having to go through a company like us. But we're the second best option to permanent staff.
Well, and that gets back to a little bit of the money making or just breaking even aspect that your father was just talking about too, right? Doing it for the greater good of the community. How fulfilling is that, Graham? Yeah,
it's super fulfilling. I think if I didn't find that fulfillment, it would be hard to, continue in this role, just with the different challenges that I face and the staff faces every day. I think if you didn't have that fulfillment and, just that mission, I don't know if it would be worth the challenges and struggles. So,
yeah, I think Graham, it's also, and you understand this, and we talk about it, it's a sense of calling. A doc comes out of their training and education, or an NP, PA, and hardly anyone goes into healthcare that doesn't want to really help people. Now there is that section or percentage that it's all about the money, but most people at their core want to help, but they need to make a living. And so we find those people, and we're known, we, as our staff and I speak in residencies and medical schools and medical associations, just like you do, Joel, and in many cases, we're there to inspire them, to motivate them, to let them know there is a way to fulfill your calling, to help people who truly need healthcare. Maybe they don't have the access to it. You don't have to move to Johnson County and open a practice or work for one of the hospital chains. You can work, in Waukene, Kansas. You can work in St. Francis Kansas. You can work in Cameron or Bethany, Missouri, and we go on and on. And so we try to attract providers who really have that sense of mission, sense of calling, and so it is fulfilling, because when a person fulfills their life purpose, when they find that meaning in life, which is really our purpose on earth is to serve other people, whether it's through on the for-profit side or not for profit or whatever. But when you do that, there is a sense of fulfillment that's incredible. And that's what we try to do with both our staff that we hire to work in these places and our volunteers that travel the world serving.
Very well said. I think that sums up certainly what you guys are doing and what everybody, I think, hopes to do or hopes to have the opportunity to do in whatever the profession. A lot easier said than done. You guys, I think, make it look easy. I know that it's not. Let's get to the baseball themed questions. And Graham, I'll start with you, since you and I were last walking out of a baseball stadium at Kauffman. What's the biggest home run? And we're not talking baseball. What's the biggest home run that you've hit professionally?
Sure. Yep. And I'll remind you too, that game that we were at, I think we lost 9-0. That was a rough one. So,
yeah,
and people were hassling you, and you kept telling them, "Not my fault."
Yeah, not my fault.
Yeah,
wasn't me. I'm just here to talk about it. That's
exactly.
That's my world, by the way, which is fine. Like they need someone to vent to. So I'm often that guy.
Exactly. But yeah, I would say, I thought about this question, and for me, it's all about treating the staff and our providers well, helping them to feel valued. So I'd say a home run that I've hit is for our company, Docs Who Care, to be recognized as best places to work in Kansas City for the second time. We actually were at Arrowhead 2 nights ago for the award ceremony, and so just to be recognized for one of the best places to work in Kansas City, and that's based on employee surveys and how they feel valued and fulfilled and engaged and all of that. So, that's my ultimate goal, is to have a team, an administrative team here in the office that we're hitting all those boxes. And so to have that recognition, I feel like is a home run for me professionally. And again, just continuing the foundation that my dad laid, and then the CEO after him, and just continuing that legacy.
Gary, your son sounds very much like a polished executive, and so that is part of the role of leading this organization. So I know that has to make you incredibly proud. Other than having an incredible son, which could be a home run in itself, how about a home run professionally? Yeah.
So great question, and of course you already answered the question. I mean, I think bringing on Graham. And he had to work his way up to the CEO position. He started out as a staff accountant, didn't work directly for me. And then as he built experience and trust with the staff, he went to the COO position, and then now he's at the CEO position. So, but the home run for me would be, and people ask me this question, not in baseball terms, but how did this organization or that organization become so successful? What's the secret? What did you do? And I always say it's really bringing on good staff, good people, inspiring them, and then trying to get out of their way. Now, Graham knows I don't always get out of the way. I don't micromanage, that's for sure, but I don't think I do. But I try to let people do their job and have the opportunity to make mistakes. I may not be happy about the mistake, and they may do something that I wouldn't have done, but bringing on great people, giving them a vision, and then and inspiring that vision and supporting that vision and mission, and then letting them just take it on. And whether it's Heart to Heart, Docs Who Care, Global Care Force, whatever the organization, there's been others. That's been the home runs that I've been able to hit. Every one of those people, many of them are still with me 30 years later. And it's just, I'm very blessed and privileged to have worked with great, great people. They've made it happen, not me.
It's always about the people. Great stuff there. That's universal. Graham, how about a swing and a miss, and what did you learn from it?
Sure. Yeah, I mean, mine's a little bit more broad than a specific swing and a miss, and I feel like I'm talking to my therapist a little bit, but I would say just being a perfectionist, oftentimes it's hard for me to delegate. And if I feel like that has limited not only me, but our organization at times whenever I feel like I need to be the one to make this thing happen, or not being willing to take that risk. I feel like that has definitely caused us to not maybe jump through or take some risks that we should have. But just learning again that, in order to be successful, I have to be able to trust my team and to delegate. And it's always easier said than done. And I like to say that I'm a recovering perfectionist because I'm working hard at that. So
evolving, and that's part of being that CEO as well, and delegating and learning. Not only can you not do it all by yourself, you shouldn't be doing it all by yourself. And by the way, we all go through that. And I'm sure, Gary, you've experienced that over the years as well. How about a swing and a miss for you? And what did you learn from it?
Yeah, well, doctors are not trained to work so much collaboratively. You're kind of the top of the food chain when it comes in the healthcare system, and you're supposed to make decisions and tell people what to do, and they should do it. And then I also joined the Army Reserves when I realized they really were short. The Army was short on good doctors, and I felt like I had the time, and it was part of my personal sense of calling and mission to be a part of the U.S. Army. So, and I rose through the ranks, became a colonel, actually became a commander of an Army hospital. And, the Army it's about rank, and if everybody below you is supposed to jump when you say jump. So early in my career, I was very demanding, high expectations, still have high expectations, but I didn't treat people well. I expected them, I'm the doc, and with my military background, just do what I say. I've got the right ideas. End of discussion. Well, it took me a lot of years to learn that there's a better way to lead. And I was mentored by people that work for me, previous CEOs that showed me a better way. And Graham certainly has those skills, and I admire that, and it has helped me soften over the years in my leadership and be more collaborative, rather more of a team rather than a top down. And Graham understands that and leads that way. I also want to say, Graham, it's good to have some perfectionists in every organization. Everybody comes to the table with different skills, different personalities, different, whatever it is, Myers-Briggs, Strength Finders, Enneagram. And actually, at the end of the day, all those programs really are saying everybody has gifts, and we, as a team, we bring out the best in each other, and it makes for a great combination. So, I know it's not fun being a perfectionist. It's also not fun being a hard-driven, do it my way person as well, because I've caused a lot of people to have tears and collapse in my office or whatever, and that's not good. So but together we're better together, let's put it that way.
Pretty cool stuff. I feel like I have both of you on the couch right now, but this is really nice stuff and heartwarming, and I think a lot of lessons to be learned there as well. Final baseball themed question: small ball. What are the little things that lead to big results? And Graham, I'll go back to you.
Sure. Yeah, I think for me, it's the little things are just showing appreciation and value to both our staff and our providers. So, just trying to do little things that may be considered small ball, but, sonic runs, making pancakes for the staff randomly. We go on afternoon walks every day at 3 just to kind of, as a staff, to just take a break from our desk and, clear our heads. So just the little things that, in the scheme of things don't matter, but I think really help build our strong community here in our culture at Docs Who Care, and having a Halloween trophy for costume, and just all those little things that take time and effort, but help people to want to stay engaged and working for Docs Who Care, hopefully forever. And we do have a lot of long tenured employees, I think, because of that.
Yeah, those things all matter. That's why they're small ball. That's why, and to me, small ball is always about culture, or vice versa. So, Gary, how about for you? What is small ball?
Well, I agree. I knew what Graham was going to say. We didn't talk before, but Graham is good at that. Really appreciating the staff, and the staff appreciate the fact that he does these things, and it's dozens and dozens of examples like this. But for me, one of the things I've tried to instill in our staff and organizations that I lead is, let's don't take ourselves too seriously. Let's have some fun. Let's be silly and laugh. Let's do fun things together. And so, and Graham has continued that tradition, through the many things he does with the staff. But I think, we've got to have time to, laugh sometimes. Our mission is, in a sense, in a transcendental, at the end of the day, serving people. It's about loving people. The greatest commandment was love God, love your neighbor. And so we love each other. We serve each other. These rural communities, we love them, we serve them, but we also laugh. And I think that's a great combination.
Work hard, play hard. That's our motto, which I know a lot of companies are, but we actually do that. We try to.
It's not a bad motto to have, and I would echo all of these thoughts and say we all in this day and age could do a little bit better or benefit more from loving thy neighbor, because we're in that world right now. But it's always there. There's no doubt to me. I mean, I'm an optimist at heart. All right, 4 final questions as we round the bases. The first one I will throw out. It's going to be a similar question to both of you, but the first one I'll throw out to Graham, because as a kid, you're getting the exposure and the opportunity to travel all around the world, to see things that maybe not a lot of kids, or adults for that matter, get a chance to see, visiting over 30 countries on humanitarian trips with Heart to Heart International, and having that exposure. Did you have a favorite place that you visited, or one that moved you the most?
Yeah, I would say Tanzania, Africa. We did a Heart to Heart trip over there whenever I was 12, about to be 13, and just visiting a school there. And we took books and instruments, and just seeing how these kids, how happy they were with, not many possessions, and how, they found just joy in the little things. And it just, it caused me to realize how spoiled we are in the U.S., even with so much. But and I got to celebrate my 13th birthday on a Serengeti safari too, and so that was neat to have a little cake with out there in Tanzania. So I'll never forget that.
Really cool stuff, and some of the extra perks of being able to be involved in all this important work is getting a chance to see the world. All right, for you, Gary, I got to go a little bit more specific on this one. I know you've been to a million places or something close to that with all of your incredible work locally and around the world. But tell me about what has to be one of the wildest motorcycle trips of all time. There aren't a lot of people that can put this one on their check the box list.
Well, there was a doctor a famous South American doctor who had a motorcycle. His name was Che Guevara, and they made a movie about him called The Motorcycle Diaries. And he, as a medical student, he drove this was probably in the 20s or something like that, 30s. He drove around, that's the 1920s, by the way. He drove around South America, from Argentina up to Bolivia and various places. And I was inspired by that. So some friends of mine, ended up being 3 of us that finished this ride together, and we decided we are going to ride motorcycles from the tip of Argentina, the furthest road south before you can fall into the ocean. And we're going to ride our bikes all the way back to Kansas City. And we had already driven our bikes from Kansas City to the Arctic Circle. So we thought, well, that will complete the entire continents, the furthest you can ride. And so we spent 2 months or more on this South American adventure, Central American, of course, and then back to Kansas City. It was a very hard ride. All of us said we'll never do it again. There were times of danger, but the times of just wonderful intercultural exchanges, seeing the world in a different way on the back of a motorcycle. It's an amazing thing. And I'm just glad I found a couple of friends that were crazy enough and had the time to do this. And we use it as a fundraiser. We paid our own expenses and raised, I believe, around $500,000 for charitable causes in this ride. So Miles with a Mission, it was called. You can still find it on the website, the story of this epic ride.
Pretty
in
cool.
2011.
13 years ago.
Oh my gosh.
All right, third question as we round the bases. I want to stick with you, Gary, on this one. A lot of people will describe great humanitarians as something along the lines of, oh, he or she is a Mother Teresa. Not a whole lot of people have met Mother Teresa. Well, I guess a lot of people have met Mother Teresa, but tell me about your experiences and when you're doing big time humanitarian work at the level and the magnitude, maybe you have a chance to rub elbows. Tell me about your experience.
Well, I have, I, as a young doctor, I was volunteering at a hospital, mission hospital in India. And I knew that Mother Teresa lived in Calcutta, and that's where her mission and the missionaries of charity started. So I decided, okay, I want to go volunteer. And that was before email. You didn't email, you just showed up, knocked on the door of the mother house, they called it, where she lived there in downtown Calcutta. And so I did. I just got a plane ticket, flew, knocked on the door and said that I'm a doctor and I'm here to volunteer. And the way the system works, you meet her and she decides where she wants to send you as a volunteer. It could be an orphanage, could be a leper colony. Of course, she's most famous for the Home for the Dying. That's how she started her work, taking the homeless off the streets of Calcutta and lovingly caring for them, feeding them, holding them. It's a hospice, basically, in the last days and weeks of their lives. And she said, she sent me there. And which, as I thought, yes, give me some sick patients. Maybe I can save some lives. But that began a friendship with her and her missionaries of charity that continues to this day. I continue to send volunteers to her ministry sites around the United States and Mexico and other places around the world. So she was an inspiration to me. She inspired me to start Heart to Heart International and really set me on my course of not just doing volunteer medical work myself, but establishing organizations that could do it on a larger scale with many more people, many more volunteers. So Mother Teresa changed my life, no doubt about it.
There aren't a lot of people that could say that. There are, by the way, a ton of people that could say that, but it's not everyday conversations that we're having on a podcast where we're saying, well, Mother Teresa meant this to me. And so that's pretty amazing, because I'm sure that, even in her passing, which has been now 25 or so years, that she lives in a piece of you every single day, which lives in a piece of Graham every single day, and lives in a piece of Docs Who Care every single day, and Heart to Heart. And so that's what I'll wrap it up with my walk-off question. We talked a bit before, Graham, about the fulfillment. I'm curious, because I think everybody, if they could be so lucky as to have a job where they know their purpose, they feel that purpose, and that's really what we hope everyone can do, right? And not everyone is so lucky. Sometimes that purpose is just putting food on the table, allowing your family to survive. And that might be the greatest purpose of all. I'm lucky. I get to talk about baseball every single day and then hopefully make people's lives a little bit better. Is it the life and death work that you guys are doing? No, but I've found my purpose, which is very uplifting. And by the way, that's a continuing journey. It doesn't just stop.
Right.
Let's wrap it up with what it must feel like to have such a significant purpose and an ability to make people's lives better, Graham.
Yeah, I mean, it's unbelievable that I feel like it's a blessing that I have this opportunity to be able to lead our team here and just to impact both providers and the hospitals that we work at, and just to hear the specific stories about how someone impacted their child or their spouse or father or mother whenever they were in their greatest time of need, whenever they were having a life or death situation, and how our provider was there to save their life and get them the care that they needed. We don't take that lightly at all. Just the impact that we have, and it's a lot of weight at times, knowing that we have to find a doctor to work tomorrow, and at our hospital in Missouri, no matter what, they can't shut down early. It's a ER, so that's a lot of weight as well. But then knowing that without them, there would be negative consequences. So I think that's just always in the back of my head and keeps me going every single day, for sure.
Well, with the fulfillment and the purpose comes the stress and the pressure, and the result is everything that you just talked about. Final words will come from the founder and the doctor. Gary, I know the work never stops, but you think about where it started and where it's at now, and all the different spin-offs, for lack of a better term, and all the different endeavors well beyond Docs Who Care. When you look at the overall body of work, I know you're a humble guy and you've been honored in many different ways. When you sit back and look at it, what do you think?
Well, thanks. Great question. And Joel, this has been a great experience. It's always helpful to me to focus on the essentials and what's important in life. And so this has been a great, like you said, I feel like we've all been on the couch here. But, what drives me is helping people find their sense of fulfillment and mission and calling in life. And I believe we're not here on this planet by accident. There's a purpose to our existence. You may not believe in the same faith, the same God, but we're here for a reason. Mm-hmm. And I believe that reason is to serve each other and to make the world a better place. And I like to inspire people and challenge people that no matter what gifts you have, whether you're retired or not, whether you're wealthy or not, whether you're healthy or not, disabled or not, you're a doctor or you're a clerk a ward clerk on the floor that, takes the orders from the medical team. We all can contribute. We can all serve each other. We can make the world a better place. We can change the world. We may not be able to change the whole world, but we can change the world for one person at a time by the way we treat them, the way we interact with them, the way we value them, the way we see them. So, doing it whether you do it on a small scale or a large scale, the point is, are we all doing what we're here to do? So that's my closing shot.
Yeah. Yes, it's a good shot. It's a walk-off, which was the whole point of that. This has been so much fun for a father-son team that deserve all the recognition. Graham Casey Business Journal's 40 Under 40. Gary, 2024 Ripple of Kindness Award finalist from the incredible Mindy Corporan, and I've done work with her organization, and she's doing exactly what you say. In the light of tragedy, losing her father and son all in one horrific shooting, but so many to talk about. The 2014 Johnson County of the Year, first ever humanitarian award from the American Academy of Family Physicians. I could go on and on. You guys know all that stuff. I know that's not what you're necessarily looking to hear, but all worthwhile with the amount of work that you've done and continue to do. I want to let everybody know, if you want to learn more about Docs Who Care, really simple, and we'll have it in the show notes, docswhocare.com. The father-son team of Dr. Gary Morsch and Graham Morsch. Guys, thank you so much for spending time, for all the important work you're doing, and really enjoyed this.
Thank you so much. We enjoyed it too.
Yeah. Thank you, Joel.
Goldberg. It's around the bases. Everybody knows Joel Goldberg.